Aloha! Wesleyan Zai here, founder of the Institute of Advanced Anti-Aging Happy Healthy Hawaii, where we teach you how to become real healthy without any drugs or surgery. Okay, today's topic is the top 10 signs of medical quackery and how to spot it. Special thanks to naturalnews.com for some of this information. Okay, number 1. Your doctor prescribes medications without testing you for anything. What? Doctors are big on scientific evidence. I would think so. They demand that millions of dollars be poured into research to prove that things work. Yet, when you visit their office, they don't gather any verifiable evidence on what they're treating you for. Isn't that interesting? You spend a few minutes with a guy who prescribed powerful medication to mess with your neurotransmitters, but no tests, not even a questionnaire. You bring your kid into a pediatrician and leave a few minutes later with powerful brain stimulants for attention deficit disorder, hyperactivity disorder, and the doctor never did one test. Be careful, something wrong with that. He's a quack. You know, quacks don't know of any tests for many of the conditions for which they regularly prescribe medications. Spooky. Okay, next, number 2. He tells you it's all in your head. Telling you that your real symptoms are all in your head. Translation, he thinks you're crazy. It means that the answers are not in his head. When quacks don't have the answer, they don't consider that there is anything for them to learn. They just blame you. Nice, huh? A legitimate practitioner will admit when he doesn't know something and commit to finding real solutions by expanding his knowledge or working with other practitioners on your case who may shed fresh light on the subject. Makes sense. Next, number 3. He denies the role of lifestyle, nutrition, and stress. The doctor says, hey, go eat donuts, camp out on the couch, drink booze, no problem. This has nothing to do with disease, just take your pills. Nowadays, some quacks are conceding that lifestyle and diet do have something to do with the onset of disease, but they're still not talking about it. They never mention it. They don't ask you how you eat, sleep, or manage stress. Why? Because they don't know much about these things. When practitioners don't know much about the cause of 90% of disease, I call that a scam. Don't you? Next, number 4. He'll put you on the medication roller coaster. Sounds like you? Believe me, I was there too. It didn't work. Some unfortunate folks, after dealing with a quack that doesn't know what he's doing, ends up on 10 to 20 pharmaceutical medications and have lost touch with what it really feels like to be normal. You know, brain fog? They live in a world of symptoms and side effects, and for some reason, they keep on going back for more. Well, that was me, but that's me no more. I hope that's not you. If you want to learn more, come talk to us at the Institute of Advanced Anti-Aging Happy Healthy Hawaii. We'll set you straight with the truth. You know, quacks respond by continuing to dish out more medication, but he has no idea how these medications are interacting with each other, really. He's just guessing and writing more prescriptions. You know that negative drug interactions kill over 105,000 people a year, and that's taken as directed. Don't be a statistic. Learn more. Give us a call today. Okay, next, number 5. The doctor's own health is a mess. Does your doctor walk the talk? Does he look healthy? Is he an example of true health? If not, then he may not even know what genuine health feels like himself. How is he going to get you healthy? How is he going to get you there? Doctors are among the most stressed out and suicidal populations on earth. Bless them. For they maintain crazy schedules and are truly under duress. Still, that's no excuse. We are all stressed. Doctors are supposed to be examples, are they not? Next, number 6. He doesn't involve you in your own treatment. So, well, you heard of this test or that lab test, might be worth doing. You read an article or did some of your own research. Is your doctor interested? Is he willing to consider that you may know something? You know, quacks look down their nose at you. But real health practitioners will cooperate with you in your own treatment. They will investigate with you, consider your ideas, your feelings, and work as a member of your team. Remember, you hired the doctor. He didn't hire you. You can fire him if you want. Okay? Remember that. Number 7. He believes you cannot heal, but he treats you anyway. So, example, you have a disease for which there is no cure. You need to take these pills for the rest of your life. And please don't believe that nutrition, vitamins, herbs, God, or anyone else can heal you. You are stuck. Take your medication. I've heard that before. I'm sure you heard that one too. Don't believe it. Not true. Meanwhile, thousands of your fellow human beings are healing from the very symptoms that trouble you. You are dealing with a quack who will medicate you into oblivion and witness your inevitable decline according to his expectations. I've seen that. I've seen people, on treatments, cancer treatments, and they're going down the tubes, they're declining, and he doesn't stop. He just keeps on treating them, and then they start losing their mind. It's very ugly. And I'm not going to be a part of that. No way. And you shouldn't either. Okay? Give us a call at the Institute. We'll educate you, teach you what's the right thing to do, and get your health back on track. We restore your health in just a couple of months. Absolutely. Number 8. His communication skills are pathetic. The doctor tells you you have 6 months to live. There's nothing more that we can do. There's the door. Well, thanks a lot, Doc. Thanks for the compassion. Some people, they're kind of tactless sometimes. I've seen that. Next, number 9. The doctor spends less than 10 minutes with you. Recent research shows that new doctors are spending less time than ever with patients, an average of only 8 minutes. This is not headed in the right direction, folks. This is your health. This is the most precious gift you have. It needs time and attention and real expertise. 8 minutes is not enough. New docs are quoted as saying, we just don't have time. The translation for that is, we don't have time if we're going to make a lot of money. They try to run a lot of people through the office, and they charge you $85. Well, they charge your insurance $85, right? So they try and do about 30 patients a day, Monday through Friday, throughout the month. That equals about $51,000 a month, just on office charges alone. So the more people they can run through, the more money they make. But that means less time for you. So how much does your doctor really know you? He doesn't know you. He knows your file. Be careful. You know what doctors say? Money before patients. Well, you know what? To me, that equals quackery. The patient comes first. Life is precious. Call the Institute. Number 10. He thinks he's God. In spite of all obvious signs of quackery, the doctor still thinks he's all-knowing. You're still not connected with him as a person. He doesn't see you as a person. He won't take your ideas and suggestions because you obviously don't know anything. After all, he's omniscient. I've been there. Don't believe it. Okay? Come to people that can really help you. We can help you. Stop supporting your quack and find real help. Do it intelligently. Begin to seek integrative and alternative practitioners who, according to the 10 signs of quackery, qualify as real health practitioners. Thank you very much. Wesleyan Zai, founder of the Institute of Advanced Anti-Aging Happy Healthy Hawaii. We have a better solution. Call us today. Thank you very much.